Okay, good morning everyone and welcome to the THSADA Athletic Trainers Roundtable, which will focus on best practices as we return to practice and play here in Texas. As you join the meeting, we ask that you register in the chat room with your name, school, and position. This meeting has generated quite a bit of interest across the state, and we expect to have over 800 attendees in our Zoom chat room and watching live on our YouTube channel. In a moment, I'll introduce our moderator, Scott Galloway. But first, I'd like to introduce our two THSADA state sponsors to share a few words. First up is Steve Tinnell with DTN.
Good morning, everybody. Steve Tinnell with DTN here. First off, I want to thank you all for letting me be part of this meeting. I know we have some very challenging times, so I appreciate you guys being very creative and putting this on. What I want to do is just kind of go over a quick video, make it very short and sweet, show some of you current DTN customers some of the brand new features we have to offer, and then also for some of you that don't know much about DTN, a quick little overview of what we do. DTN is the world's largest weather company. We are the official weather provider of Major League Baseball, Major League Soccer, NFL, NCAA, and as many of you know, we have thousands of high schools across the country that use DTN as well, along with most of the airlines you fly on and airports you land on, and so on. It's a web-based application that also comes with a smartphone app, and we have a new solution that we can even put an outdoor siren solution as well that I will show you towards the end of this call. So real quick, you have the ability to basically look over all your football fields, baseball fields, all your athletic events very easily, kind of a one-stop shop. So it will give you your local radar, your current conditions, which update every 60 minutes, and we do record wet bulb globe readings every 60 minutes. Is there any major weather issues? We have over 150 weather patterns. One of them is the precipitation timer that will tell you exactly when the rain is going to start and stop. So this is going to be big for you guys regarding rain delays. How long is it going to be? When's it going to end? And when can we start play again? Probably the number one reason, of course, is for lightning information. And this is another patent technology. So it is all real-time data. It updates about every 10 to 12 seconds, and we push it out to you every 60 seconds. As you see, the screen just blinked because it did actually add more strikes. You can customize the lightning. Our recommendation is warning inside 8 miles, and you see we do have a caution and advisory. That way we tap you on the shoulder as the weather gets closer and closer. Very simple. Red means stop, green means go. As you can see, we have a lot of strikes inside the warning range, and then we also give you a countdown timer, which we recommend 30 minutes after the last strike. This will count down automatically. If it does hit a strike as it's counting down, it will reset, or once it hits 0, it will send you an alert to you and all your staff and on the desktop telling you it's all clear. It's okay to go back and play again. Some of the new features I want to show you is our new thing called Executive Summary. So you can actually go into our system now and say, listen, I only care about certain things. I want to look at it really quick, and I want a yellow, green, red type solution. So this example, I have heat conditions as my big concern, and I have it at wet bulb globe. So I see I have some yellow and some greens. So I can easily highlight over these, and I got a really quick window to work with my athletic director, my coaches, my trainers, etc. on when is a safe time to practice. You can customize this. So you could have your 2 or 3 thresholds of your heat conditions that you're concerned about. And then of course, we give you your hour-by-hour breakdown for forecast. And again, now you can customize it. So I just have wet bulb and precipitation chance on here. I got rid of humidity, dew point, all the stuff I really don't care about. So when I look at this, I can go hour by hour and say, listen, I have an issue between 1 and 3 p.m. With the system as well, you can set it up where we alert you and all your staff regarding pretty much anything you can think of. So we can set out lightning alerts, heat condition alerts, you name it, we have it available to you. Again, all this information is also available via smartphone, and please ask about our new siren solution where it will actually set up the alerts through the system regarding lightning or severe weather, and we can easily send you alerts through an outdoor siren solution that would alert everyone available. That's all I have for you guys. I appreciate your time. And if you need anything, please let me know. My contact information will be passed on. Thank you.
Next up, we're going to have Kynze Mann from Rank 1 Sports and Health. And Kynze, welcome. Thank you for being one of our esteemed state sponsors. What words of wisdom do you have for us today?
So basically, just with school starting back and the craziness that's happened, I'm just going to talk about 2 additional features that we have that may help athletic trainers get into the new school year a little bit easier. So number 1 is our COVID screening questionnaire. A lot of people may have already seen it, but if you haven't, we do have a video of how the feature works on our main website, just rank1sport.com. So before you log in, at the top in red, there's a little video you can access. And basically, it ties into your online forms. So it's a daily questionnaire that the students can fill out. And then it ties into a report on your side. So you can see what the students answer. You can record their temperature. We also have that available for your coaches to fill out. So it's 2 questions for your coaches. You know, basically, do they have COVID-like symptoms, things like that. And you can also track their temperature as well. So that is our COVID screening tool. And then secondly, our Rank 1 Health platform basically is created to bridge the gap between you, the athletic trainer, and your team dog or healthcare network and provide secure communication. So instead of faxing or texting student information, you know, when they get hurt, we do have a secure platform where you can send, you know, messages, and it actually gives the providers a window into their injury history so that they're able to treat them better and faster. They can also upload pictures like an x-ray if you needed to see that, even things like their return to play document. So instead of having to chase students and parents down for that information, they can just pass it to you electronically. And then again, you know, with everything being contactless, that's great for you. That's just one less thing you're having to touch or ask for, things like that. So there's more information on our Rank 1 Health website on that. And if you'd like to see a demo with you and your provider, we can definitely set that up. So for any questions on the COVID screening questionnaire or Rank 1 Health, you can email us at support@rank1sport.com, and one of our reps can either set up a demo for you or get you pricing information, all that kind of stuff. But basically, that's all I have. Thank you guys so much for watching. We appreciate all of y'all's support, and hopefully we can get back to school safe and quickly.
Very good. Thank you, Kynze. We appreciate you and Steve being here today. The continued support of our state sponsors is of the utmost importance to THSADA, and we thank you guys for being here today. Next on our agenda today is I want to introduce our Executive Director, Mr. Rusty Dowling, to say a few words. Rusty?
Thank you. First of all, I want to thank all of you for attending the webinar this morning. Over the past couple of months, the Texas High School Athletic Directors Association has done numerous Zoom meetings and webinars, all of which you can find as a resource on our website. This particular webinar this morning is unique as it's the first one we've done that focuses on health and safety and features athletic trainers along with medical professionals. Now, before I turn it back over to Bob, I have several quick announcements that I would like to make. A reminder that our THSADA State Conference is scheduled for December 8th through 11th at the Waco Convention Center, and all registration information can be found on our website, THSADA.com. We encourage you to attend as we have several classes each year that focus on sports medicine. In fact, Scott Galloway has taught several of those classes himself. I want to encourage all of you that are not members of the THSADA to consider joining the association. Quite a few athletic trainers have athletic administrative duties within their district or campus, and the THSADA can support and be a resource for you. Membership for this upcoming year opens on September 1st. You'll have the opportunity as a member to attend THSADA events, take advantage of our Texas Athletic Administrators Certification Program, network with your colleagues, and take advantage of the resources afforded you through membership with THSADA. And again, I encourage you to join. Membership starts September 1st. So again, thank you all for doing this. I'm going to turn this back over to Bob.
as a former coach and AD for 38 years, I got the firsthand experience of knowing how important the role and vital role an athletic trainer plays on our coaching staffs and keeping our kids healthy and safe and taking care of our coaches. But never has that been more important than for the spring and the summer and the fall we're about to enter, with the COVID-19 being part of our lives. So we wanted to do a webinar today, or a roundtable, to kind of discuss the role of the athletic trainer, the best practices in which they institute the safety protocols for our kids and our coaches, and try to comment on some of the things that make this job difficult, but also probably, if we're going to be successful this fall and winter, a lot of it's going to fall on the coaches and the athletic trainers working together to continue having a safe environment. Leading our seminar today is Scott Galloway. Scott is the Associate Director of Athletics in White Settlement ISD. Scott, we want to thank you and Melanie and Rusty for organizing today's meetings. And Scott, why don't you go ahead and take it away and lead today's webinar.
Great. Look, I really appreciate just the leadership of the THSADA, and, you know, Bob and Rusty in their careers were really on the front side of making healthcare a priority in their school systems, with hiring athletic trainers and putting them in leadership positions. And so really appreciate their vision and the association's vision for making health and safety a priority. We're going to dive right in. I know there's many people on the call who have many questions about COVID and procedures, but we really want to take an opportunity today to start really with a global approach, and we're going to get to some of those specific operational items later on in this broadcast, but really want to take an opportunity to talk about, I'm going to share my screen now, this particular model. I hope you can all see that. It's called the socio-ecological model of health, and really everybody on this call represents a piece of this interconnected model. Obviously all of us have a you point in here, but each of these panelists, whether they're athletic training staff, administrator, you know, a higher ISD or community official, and then obviously with KSI and UIL and state associations, we're all interconnected here. And I want us to talk about, with the spotlight being on athletic directors and athletic trainers during this pandemic, I'd like each panelist at this point to take a moment and introduce yourself and really explain your role in your school and in your community, and what relationships that you have seen that are key as you navigate this pandemic. And I'd like to start with Jamie Woodall.
Thank you, Scott. I appreciate that. I work in Boerne ISD. I'm the head athletic trainer, and my responsibilities include overseeing the junior high and high school athletics, health and safety, which is the same for most athletic trainers in the high school setting. But I also have been appointed to lead our district's COVID response plan as a district. And it's something that has been very challenging and but very encouraging, as we've used our summer strength and conditioning workouts as a model for how we can do this in the classroom. So if we can work out 10 feet apart from each other, we can go to class 6 feet apart from each other, is kind of the idea that I've, little motto that I've created for our administration. And so I'm hoping it's very encouraging to them. One thing that I've really harped on is that we've had hundreds of kids come through wearing a mask, going through the procedure of screening, and then our band, dance, cheer, all of them, they're doing the same thing. And so when we start school, we have a large population that's already familiar with the process. And that includes our coaching staff. And they are leaders in our school just as much as anyone else is, and they already know the procedures as well. And so that's something that I think our administration needs to know and find encouraging with our situation. One of the relationships that I value the most at my workplace is with the athletic director, who's also the head football coach, and the strength and conditioning coach. That's Elliot Allen and Rory Faber. They have worked, we talk daily, multiple times a day. Rory Faber, the strength and conditioning coach, makes modifications and alternative workouts for athletes. He takes his job very seriously. He's very knowledgeable. And we have a very respectful relationship that's, that benefits the kids for sure. And then along with that is the Washington County EMS. We in Burnham we're 5A, but we're still very rural. And so we don't have a health department. And we have a local health authority, but we don't have a health department. So we don't have a lot of the resources that some of the larger areas have. And so Washington County EMS, their medical director, Dr. Lush, he has been instrumental in making sure we're communicating constantly to make sure our community and our school response to COVID is consistent. Because if that's going to be very different, it's going to be very hard on our community. And lines are going to be drawn and opinions are going to be made. And so I think that's very important. And of course, we have our athletic trainer communities. We all have our little circles that we work within, but then we also had a webinar earlier this week where athletic trainers could just kind of popcorn question, and Scott Galloway was part of that. And I think that all those relationships are important, but understanding that athletic trainers generally have a strained relationship with other people because of the nature of our job. Add a pandemic to that and it can get really nasty. So I encourage everyone to base your response on best practices and data and try to leave the opinion out of it. And if someone decides an opinion is very important, let them have it. Even if it's not your opinion, let them have it, but keep yours maybe out of it and stick to what we do know, even though it's not blocked.
Awesome. Thank you, Jamie. Let's go to EJ.
Thank you, Scott, for having me on. My name is EJ Hairston. I'm the Director of Sports Medicine at Waxahachie High School. I agree with Jamie. You know, relationships are very important in what we're doing right now. I sit with my athletic director, Greg Reed, several times a day to discuss, you know, what our next steps are going to be. Our football coaches have been instrumental in making sure our kids are wearing their masks, making sure they're spaced correctly in the weight room, outside. They've just been phenomenal as far as helping us out. I've also made a great relationship this year with our custodial staff for the district. Just having them as a resource for cleaning supplies, for things that I don't have here in the summer. They've offered to move forward with us in the school year to help us with more hand sanitizers in the school, possibly in the classroom, more disinfecting in more places, cleaning more often in certain spaces. They've just been very instrumental in what we're trying to do. Our administration has been helpful, providing us with other resources, providing us with guidance, following our lead in some areas. They've been great with us. And most important for me is my sports medicine staff. The ability to have other people here with me that I can bounce the ideas off of, that's willing to step up and share their ideas, and also hold the kids accountable. We are working in two spaces here in Waxahachie. The girls are in one location and the boys are in another. So just having them here to help me, to support me, just makes a huge difference. So, you got to hold those relationships. There are going to be some tough conversations, but you can't be afraid to have them because we're all here for the same thing, and that's to take care of the kids.
Awesome. Thank you, EJ. Let's go to Chris.
Hi, I'm Pharr Shattuck. I've been a Texas high school athletic trainer for 21 years. I'm currently the head athletic trainer at Dawson High School in Pearland. And I have additional athletic training experience working from youth athletes, elite athletes to Olympians. Throughout my professional career, I have based my professional career on three basic rules: hard work, passion, and professionalism. One of the most important things we can do right now is create some sort of written procedures for each individual district or even each individual school. And collaboration is key to make sure everyone's on the same page and following proper procedures for each campus. Each campus might be slightly different within your school district. I see my key collaborators, my key relationships are, number one, my administrators, my athletic director, director of maintenance and operations and health services. This is where the money is. So in our written guidelines or our recommendations, if we have something that we need that we can't get in our normal budget, these are the guys that are key to unlocking the funds, or they can go up the chain very quickly and get those funds that we need to purchase items needed for this pandemic. For example, in our district, we requested a dishwasher. That's going to funds that are not scheduled or not planned in our budget. So we easily asked for that for both of our high schools, and then we received it. Coaches, I'd say number 2, they're in the trenches with us as athletic trainers. They need to know our procedures, following the procedures, and then they can help as far as enforcing your procedures to return to play. The coaches, I say, are very key in doing what we can to keep the kids on the court or field as safely as possible. I also see parents as a key relationship. They need to know the COVID procedures. They are trying to decide right now if they want to even send their kids back to school, let alone athletics. So with parents, as long as we keep them informed of what we're doing, here's our plan to keep your kids safe at our school. I think they can be on board, especially if you have a good plan, a good written plan, or you're open to answer questions or have Zoom call meetings or whatever it is, just to put the parents at ease. Lastly, I'd say community. Again, things that are not budgeted for this pandemic, we're going to be using a lot of cups this year in Pearland ISD because we're not going to use squeeze bottles. So we reached out, our district does not want to spend $6,000 on a bunch of cups for the district. So I reached out to our community just through the Chamber of Commerce website and contacted everyone on the website. And then we got over 30 cases of cups donated to our school district. So those would be my key collaborators for us.
Awesome. Thanks, Chris. Let's go to Terry.
Hi there, I'm Terry.gault. I'm the Assistant Athletic Director for Boerne ISD, and I'm also the Head Athletic Trainer at Champion High School in Boerne. I've been in Boerne for 20 years, practicing athletic trainer the whole entire time, and have been Assistant Athletic Director for the last 4 years. So started at Boerne High School when we opened Champion. I moved over there, and then have transitioned into an administrative role, and so I've kind of got a unique perspective. So as still practicing. So in our school district, our HR department is a key person to be in contact with because they're the one that developed our COVID response plan. And so our HR director is in charge of that. And she has made our school nurses on each campus the contact person on the campuses. So they are our contact tracers on each campus. And then they report results to HR. And so HR then coordinates, the response and the appropriate response for each individual case. And so obviously we have already worked closely with our school nurses on our campuses. So it'll be, again, a key relationship. And my athletic director, Stan Leach, says that relationships are the key to everything. And we all know that as we practiced even before COVID, that relationships are why we do what we do. And so relationships with your athletic administrators, your campus administrators, and now with us, with our HR and school nurses is really important. Another key relationship for us is with our community physicians. We've had a great relationship with our team physicians that we've worked with for the last 20 years. And our team physician, Dr. Richard Holcomb, who's in Boerne, has been called many, many times since strength conditioning started, bouncing off different cases individually by him, us all trying to figure out together to make sure we do what's best for everyone. And when I was speaking with him on a regular basis, especially the last week, and trying to develop policy, he thinks it's really important in any community. We have a smaller community where, physicians in our community are really invested in this school district. Many of them, their kids go to school here, so they want to play a part and take a part in our plan and make sure that we're doing the right things. And his kind of important thing to him is to get the community physicians together so that they're all on the same page on our policy as a district. And then when they're seeing these kids in their offices, what's going to be their return to play protocols? What's going to be the plan moving forward when they send these kids back to school and back to athletics, so that they're all kind of on the same page, and we're developing a community plan, a community-based plan that is the best return to play and best for our employees, best for our students, but they feel a community-based approach with physicians is important. And sometimes physicians can have egos, and I don't feel like that's the case in our community. They want to come together, they want to meet and develop what's the best plan for our community as a whole. So thank you.
Awesome. Thank you, Terry. Let's go to Mel.
Good morning, everybody. My name is Melanie Hinson. I'm the Assistant Athletic Director at Southwest ISD in San Antonio, and I also serve as the Region 8 Director for the Texas High School Athletic Directors Association. I want to thank Rusty and Bob and Scott for putting this together, because I think it's really important. And I know there's already been questions in the chat room, but I think that we'll be addressing those as we move forward. Some of the things that I want to talk about as far as relationships in our district and our planning, I think it's crucial that you communicate to your community what your plan is. You need to have a clear-cut process, and your community needs to be able to know what policies and procedures are you taking to protect your staff, protect your athletes, what happens if there's a positive. I think all of that needs to be transparent, and you know, and it's changing day to day. We all know that. Crucial to our planning was our relationship with our district health director, as well as our safety operations director and our HR department. We've all worked together. They've been awesome to work with, and again, it's changing day to day. Another big concern that I think we need to focus on, not just our athletes and not just our return to play, but I think all of us saw in the beginning weeks of strength and conditioning the toll it was taking on our coaches. They're trying everything they can do to make sure they're doing things the right way. They're concerned about the kids, and they want to make sure they're doing things that aren't putting anybody at risk. And I think that that's something that we need to really consider, is the mental health aspect of our staff and of our kids, and how we move forward with that and supporting them. And the last thing, I can concur with everything everybody else has said about working together. We went ahead, and Terry.gault shared with me a online course for contact tracing. So I've had all of our athletic trainers in our district take that course so that they can assist with our district nurses in the event that those things happen, especially in our athletic department. And so, again, I want to thank everybody for being here today, and look forward to what we have on task for us.
Thank you so much, Mel, for that perspective. Let's move to Dennis Hart.
Thank you, Scott, for having me on this distinguished panel today, and thanks to the Athletic Directors Association for putting this together. I've served as an athletic trainer for, first of all, 36 years in the secondary school setting, and the last 33 of those years were at North Mesquite High School. After I retired from full-time practice, I am a part-time employee by the Mesquite ISD, and I work in the district athletic office with my esteemed colleague Bucky Taylor, and together we are responsible for establishing policy, procedures, protocols, and supporting the athletic trainers through the athletic office. We have 10 in the school district, and then our relationship extends out into the coaching staffs through the 5 high schools and the 10 middle schools. As in my practice now, it has been an interesting experience, and certainly very rewarding for the last 15 years. I look forward to continuing to learn and to hear ideas from this distinguished group. It is important that we understand that we need to have our policies and procedures in place. As Mel just said, it's continually changing. We will be a day-to-day situation, but we still need to have a standard of care, and I think that's important. And so what we establish in the Mesquite ISD in our plan, and then we took that to the athletic trainers and discussed how we would implement that plan, and then took it on to the campus coordinators in the 5 high schools and middle schools to make sure everyone would be on the same page. So this is a great day for athletic trainers and athletic directors to come together, because so many times one of my former athletic directors in the Mesquite ISD said when he got the athletic director's job, it said, well, finally I see what athletic trainers, what their work schedule is like, because there is no off season. So thank you, Scott, for having me, and I look forward to hearing from the panel.
Yes, thank you, Dennis. Let's go to Jeff Darr.
Thank you, Scott. Thanks. I'm glad to be here with everybody. Thanks to the Athletic Directors Association. My name is Jeff Darr. I'm the coordinator for the athletic trainers at Pharr-San Juan-Alamo ISD down in the Rio Grande Valley. I'm sure if you've been reading the news or seeing the news, you're kind of aware of what's going on down here. I'm particularly in Hidalgo County. You know, I'm listening to everybody's introductions, and I know a lot of people have had a kind of an uninterrupted strength and conditioning program going on since June 8th. We have not had that luxury down here. In my particular district, we went for 4 days, I believe, before we had to shut down, and that's kind of when it started skyrocketing down here. So you can imagine the challenges. None of the school districts down here have really been doing much. There was a few that kind of held out as long as they could, but eventually everybody had to shut down in the 4-county Rio Grande Valley area. So we haven't had those opportunities to kind of test out different ideas, and we all had plans in place when we started. Some school districts didn't ever start. Some school districts went a couple of days. Some school districts were able to go a couple of weeks. But it's a real challenge down here right now, trying to move forward. Everybody's aware of the UIL calendars, and we're still I think we're pushing ours back even further, and that's all still up in the air and being talked about at the administrator level. One thing I want to do as far as the COVID, you know, I want to kind of echo what Dennis said about consistency, having policies. I'm in a multi-school district. We have 4 high schools and 8 middle schools, and I think it's really important that everybody, the district has a plan that everybody follows. I know some of the even bigger districts, sometimes there's a little bit of people they want to do their own thing on their campus, and I just don't think that will work in this situation. The other thing for me in particular, and I appreciate what Jamie was saying about her challenges with not having a health services department in her county, things like that. My district has a very well-structured and well-organized health services department within the district. Our director is a nurse practitioner, and I have a great relationship with her. I think that when we talk about making plans within the athletic department, she's involved in that, and I contact her. My athletic director contacts her, and we all talk. And so the plans that we make within the athletic department, they follow basically what our school district's plans are. So we're not just making up stuff on our own. It is a complete top to bottom, and she has a direct line to the Hidalgo County Health Department, and so we have a very good flow there. And it's going to be an interesting situation down here, and I'm kind of looking forward to hearing what everybody has to say myself. So I appreciate you guys having me.
Okay, thank you, Jeff. And listen, before we move on to our next guest, I just want to say, I know we have a lot of questions coming in the chat, specifically about operational procedures, which we 100% expected. And we are going to address those. They're on our agenda, but I hope what we're talking about now, the relationships and what Dr. Huggins and Dr. Casa are about to pivot into, is going to help show you the importance of having these relationships and having this global plan as we get into the operational items. Because once you get into the operations, if you don't have those relationships under control, and if you don't have your plan under control, and if there is a hiccup or if there is some question, you need to have those allies. And so I'm going to turn this over to Dr. Casa and Dr. Huggins, and they're going to talk about some of the questions that are already currently in the chat about best practices in the return to sports and exercise as it's related to COVID-19. And we are very privileged to have them with us. I'm not going to feed them questions. I'm going to allow them at this point to kind of take over this section of the webinar. They've got some great information to share. Thank you, guys.
All right, Scott, thank you so much for letting us be a part of this. I mean, we're super thankful to have the chance to assist. Just a little background, because for everyone might not be aware of the Korey Stringer Institute. Many of you, I'm sure, are aware that Korey Stringer was an NFL football player for the Minnesota Vikings and passed away in August of 2001. I had assisted his widow and his agent for the next 8 years as an expert witness. And when Commissioner Goodell and his widow wanted to have a lasting legacy for Korey, they had asked if we would be willing to host that at the University of Connecticut. We opened our doors in April 2010. We just celebrated our 10th anniversary. We have 80 employees at KSI. There's 60 volunteers and 20 staff. We work really closely with all branches of the U.S. military, helping them enhance their health and safety policies. Work very closely with OSHA and NIOSH and a lot of the biggest companies in America to help laborers be safe. And obviously we help a lot in athletic environments. We currently are leading the International Olympic Committee movement for safe practices for the Tokyo Olympics next year because of heat expectations. And we're currently visiting all 50 states in a 5-year process to enhance health and safety standards for high school sport. We raised $2 million so that we could host 50 different state policy meetings, and we've done 13 so far. We do a lot of other things too, and a lot of other different levels of sport. That just gives you a little bit of a glimpse of the reach that we're able to have. I want to just make mention too that our website has a ton of resources related to health and safety issues. And if you ever need to specifically reach out to us, we're available. We have staff that specifically work with on the high school sports side of things. And so they'd be very willing to assist you and get back to you very quickly. What Rob's going to talk to you about right now, he was one of the people who worked on a specific return to sport following COVID. We were very fortunate. We got the NCAA and NFHS to back this initiative, and then got 9 organizations to endorse and work with us. And we released it on June 2nd. And we were honored to be able to bring this out to everybody. And then NFHS immediately sent that to all of their 51 state high school athletic associations. But Rob was one of the members of the writing group. So that's one of the reasons why Scott obviously has him included right now. He has some really cool infographics to share. I do want to talk about some things specific to heat and return with COVID after he's done speaking, but I'm going to let Rob have the floor right now.
Thanks, Dr. Casa. Scott, Bob, Rusty, thank you so much for having KSI a part of this, important conversation. And I know there's a lot of folks asking specific questions, but I really appreciate you sharing that socio-ecological framework and everyone here talking about how within your community you interact with each other, because that is so, so important right now. We at the Korey Stringer Institute, I'm in charge of the Atlas project, which is the Athletic Training Locations and Services project, which has mapped every single secondary school in the country and the AT services that are provided at those schools or not provided. Unfortunately, there's a third of the schools in our country right now with athletics programs that do not have any AT services. And I would imagine some of those athletic directors and coaches may be on this call right now. I do know that Texas is a little higher in terms of your percent of schools with AT services than most in the country. So, kudos to you all on that. But we have some big questions right now looming. So as Dr. Casa alluded, you know, for me, it's the 50,000-foot view of this entire thing. I think we have to be really careful about what we prioritize as athletic trainers and healthcare professionals and coaches and athletic directors, and what is kind of not as important, but we used to do it day to day. Like that kid with the TheraBand, you know, stretching, you know, hot pack before an activity, not as important anymore. You know, you may, especially if you have a small congested area and you're unable to, you know, treat as many patients. You have to do, athletic trainers, coaches, we have to do a better job of thinking greatest risk. And I'm talking death and catastrophic injury, all the way down to, and then prioritize things that are less important or of less risk. Because what matters is the health and safety of these athletes returning and playing the sport that they love, and us as athletic trainers and coaches, you know, providing them a safe environment. So step back, you know, and this season is going to be unlike anything you've ever experienced before in your entire career. And we really just need to take a step back. You know, you cannot catch up for lost time with conditioning especially, and you can't catch up for all the time that has been lost. We have to take this one day at a time and try to plan the best we can, which is why you are here, and which is why we created a document which I'm about to share with you. So if I can share this here. So what you are seeing right now is the Korey Stringer Institute website. This is the return to exercise during the COVID-19 pandemic. This document is guidance for high schools and collegiate athletic programs during this difficult time. We had many folks reaching out to us asking how they could, what they should do, and here, you know, here's a meeting for that, to that point. So if you have time, please, please, please take a look at this document. It will answer a lot of questions and considerations that you as an athletic director or administrator or athletic trainer or healthcare provider might have, so that you can maybe make some more informed decisions. Now, please recognize that some of these things are based on evidence, right? And some of these other things are based on expert opinion at this time, because we do not know enough about the COVID, you know, SARS-2 COVID-19 virus. And although we are learning very rapidly, we're not learning enough to be able to make some of these decisions. So, you know, please work with those in your socio-ecological framework and those people in your communities to make the best informed decisions that you can. You know, make sure you're following CDC and state, you know, federal guidelines and things like that that are being, you know, pushed down towards you in your towns and in your counties and things like that. So the document itself, this is the document here. You can see my co-authors, quite a few with a lot of letters after their name, but some really great folks that were able to come together and organizations, American College of Sports Medicine, Strength and Conditioning Coaches Association, GSSI, KSI, NATA, all NCCSIR, which is the Center for Catastrophic Sport Injury Research, and the NFHS, and the National Strength Conditioning Association. And you'll see what this document is intended to do and what it's not intended to do. It is, you know, not intended, you know, to really tell you exactly what is going to happen with COVID. It's just to discuss some of these objectives. So why physical distancing presents added and unique risk to athletes. Think about different risk profiles of your athletes right now, how to mitigate risk with tools and resources that have already been published and that are available for you. There's 5 of those documents that we highlight specifically in this document. And then the key topics that we talk about too are interruptions to normal season. Interruptions are going to happen. You should plan on that. You're going to start, kids going to get COVID, or multiple kids are going to get COVID. You're going to have to stop and you're going to have to restart again. So you have to be prepared for that. Mentally, your athletes, it's going to be tough for those with, especially, and those without. And you as coaches and administrators are just going to have to make the right decisions as to limiting exposure and how to keep the other teams and their families and their loved ones safe during this time. We talk about PPEs, return to physical activity and conditioning, which I'm going to touch on a great deal. I know you've done some of that in the state of Texas already. And then heat acclimatization, or the process of that your body undergoes as it adapts to activity in the heat. Injury prevention programs, and using evidence-based IPPs, and then education for these items as well. So we're not trying to provide this recovery plan, discuss administrative considerations, cleaning and procedures, although the other, to follow my piece here, you are going to have some great strategies and information from all of these panelists on what they are doing to try and share their experiences that you might be able to garner and improve upon in your setting. So, like I said, that's the document that I think you should definitely take a little bit following this call or this webinar and review. Another document, can you all see the return to the PDF that I have in front of me? Return to sport and exercise. Do you see the, oh, hold on, sorry, I think I know what's going on. So this document that you see in front of you right now is a kind of just a couple infographics of that document. Please feel free to email me. I will post this or send this to Scott as well. But this is a little infographic summarizing those different sections. So when we talk about the pre-participation evaluation, medical history is a key topic here. So athletes with prior history of COVID-19 diagnosis, symptoms, or close exposure, and I'll talk more about that later, should contact their physician for return to play clearance and work through their medical providers and point of care, such as athletic trainers and physicians, to be screened for these ongoing symptoms, such as chest pain, pressure, dizziness, obviously the signs and symptoms that we hear related to COVID, sense of taste, smell, including fever and excessive fatigue. We do need to consider ECG, cardiac renal biomarker, and pulmonary testing. So physicians should be ordering these tests, especially if the symptoms and signs lead that way, to confirm that these systems are functioning properly. I know at the beginning, I'm sorry, I don't forget the woman's name, but consider the use of a COVID-19 specific questionnaire for your athletes and your coaches, and any staff that might come in contact with these athletes. Have every person check in with themselves. Do I have a fever? Do I have a sore throat today? Am I feeling any symptoms? Did I just travel or come, did someone come into my home that has COVID or from another state that might be, experiencing, higher rates? Athletes with increased risk of COVID should make informed decision about making a process with a medical provider, meaning if that athlete is concerned that their underlying condition or previous COVID diagnoses and recovery, they should have an open and informed conversation with the physician and the athletic trainer during this trying time. We need to continue to follow your state and local laws and your organizational policies for PPE, your school district policies as well, and try your best to align what the best practices are, as well as what your school is asking you to do. Really, in terms of conducting in-person pre-participation evaluations, really consider those that have played in the previous year. I know many states require an annual PPE. You may need to consider changing that for this year, except for those with underlying conditions or those who are playing for the first time. If they're a new athlete with no PPE on record, I would still encourage you to require that PPE prior to participation. In terms of return to physical activity, fitness and conditioning programs, I know many of you may have already started these programs throughout the summer, but you need to register or have your coaches and your athletic trainers register the strength conditioning program with you as the administrator or the athletic director. What this does is when you register a program, the coaches and others you're not going to deviate from that program. And if you do, you can get in real trouble. You can ask Dr. Casa, who's served as expert witness on over 50 cases of sudden death in sport. And many times when there's no program documented, and you don't have that a part of your normal fitness training schedule, you can get into real trouble that you deviated from the plan or you did something as a punishment workout. This is when we see athletes die. Identify that upper limit to properly implement what's called the 50-30-20-10 rule. I'm not going to go into the rule specifically. It's in that document and in many of the return to a sport after a period of transition that the NCAA, the Strength and Conditioning Association, and others have combined on. And then you need to really coordinate that training plan to ensure that it's reproducible, not excessive. So make sure that these athletes can be doing whatever this training is each day. And you have to do a really good job of assessing individually the fitness of each of your athletes. If your athletes are all not fit, maybe they had to return to work to help their family, maybe they did not have access to lifting or to the ability to train and run and keep their aerobic fitness up. We have to cater more individually to those athletes, just like we do in education with different plans, intervention plans with kids that may be struggling in reading, writing, or math. It's no different, and we should be doing the same to differentiate that training. We really need to use the FIT principle. If you've not heard of the FIT principle or FIT rule, to phase in training, to minimize muscle damage, that is frequency, intensity, and time of rest intervals. Keeping a work to rest ratio. So a work to rest ratio of working for 10 minutes and off for let's say, or working for a period of time, it doesn't matter what it is, but where the ratio is 1 to 4, or greater during the week, will ensure that your athletes are not going to have an intensity that's going to result in large amount of muscle damage, large amount of metabolic heat or body heat production that could put them at risk for heat stroke or for a cardiac death if they're not fit enough. Finally, I'll just stop on the heat part here. The time course of these adaptations. So the first thing that we ask you to do is establish physical fitness. This does not mean test your athletes. Don't do shuttle tests. Don't do any sort of lifting tests in the first couple of weeks that you're working with these, or first days to week of working with these athletes. We need to gradually increase that duration and intensity over a period of 7 to 10 days, which is how long it takes for us to get heat acclimatized. So we have to avoid maximal efforts and competitive play until fitness and acclimatization are achieved. And we need to really think about modifying the start date, the time, and the length of our seasons. Pushing the starting point of your season right now is probably one of the smartest things that you could do in working with your leagues. Reducing the number of games that we have this year is probably very smart, because there's going to be a lot of irregularities that are going to occur, and some teams are going to test positive and have to be shut down for a period of 10 to 14 days, unless the entire team can go and get tested. So restart or extend processes if training is paused. So if training is paused for 7 days, you have to think about getting these athletes fit again, and because these kids might not again be able to have access to keeping fit within their confines of their home. Hydration. I saw a lot of questions on hydration and water bottles. We have to have frequent and open access to fluids, and we need to, logistics. I've heard cups. I've heard touchless, water containers. I've heard athletes bringing their own water bottles, just like they would to a camp, to the practice, and cleaning those water bottles on their own. I know there's concerns with that, but we have to limit the exposure from one athlete to another, especially when it comes to sharing squirt bottles or bottles that have straws of any kind. I'm going to leave it up to the experts to talk about the logistics and those who are on the field every day dealing with this. Use individualized water bottles is our recommendation as best we can. Designating a person a staff member, someone to be able to refill those bottles who is gloved. That'll limit the exposure for anybody that doesn't have the ability to have a touchless refill station of any kind. And cleaning of those bottles has to be stressed within the confines of your team and outside of your team as well. Environmental conditions. You all know we are getting hotter by the day. You know, I know I'm from Connecticut and it may not be as hot, but you know, you have to continue to monitor your environmental conditions. Athletic trainers out there, you know what a wet bulb globe temperature thermometer is, and that on-site measurement is the most accurate for you to make informed decisions about the work to rest ratios of your players that we just spoke to. When it's a black flag condition or a red flag condition, when either practice should be canceled or moved, or heat risk is extremely high, we need to adjust our entire practice sessions to make sure that we're not putting these kids at undue risk for heat illness. And you know, rescheduling those sessions to a cooler portion of the day. So those are some of the things that I just wanted to share with you all. And the last piece that I'd like to share, because I heard someone talking about this, is this is our plan from KSI, our actual office at KSI. And what we do is we try, I would consider you making some algorithms. You know, I know another gentleman talked about policies and procedures. Talk through these procedures. Talk about what's a potential exposure. Talk about when someone does have COVID or contracts COVID on the team. Someone is visiting them from another area or travel outside of your county or town or state, right? Or you have close contact with a person. These are all recommendations that or algorithms that we've developed in concert with what we're being told from our local government and the CDC. When someone needs to quarantine or test, the first choice is a 2-week quarantine, right? The other option is a 2-day quarantine followed by testing. That's a secondary opinion. And then the last resort is an exemption of quarantine or testing. But you know, you may not want that. They might be exempt depending on the circumstances, right? So just things, I present this more as a strategy, you know, for you, you know, to maybe build off of or work off of. We did our best to try and copy what the CDC and our state recommend at this time, as well as our university. So, you know, with that, I just want to say, you know, thank you again. And I know there'll be lots of questions, you know, related to these documents. But I'm going to turn it over to Dr. Casa if you'd like to specifically talk about something that I perhaps, you know, missed or he thinks is critical to you and the information you need right now.
Rob, that was awesome. I only have a couple of quick items. One is the document Rob showed from the Korey Stringer Institute isn't just for our office space. We have a environmental heat lab where we have many research subjects every day. We drive their body temperatures up to 104 degrees Fahrenheit, and some people are in there 10, 12 hours a day in 105-degree temperature, sometimes exercising 6-7 hours a day. So we have you know, obviously the risks of these people potentially having COVID and our research staff being in there. We follow all the appropriate guidelines for PPEs. But Rob's telling you, this is not just us sitting in office. These are, you know, people exercising and us having to interact with them. So that was one. And two, I just want to reiterate just 3 quick things to always keep in your mind that's unique this year, that's different than all previous years, at least as far back as I can remember, and I'm 51. So one is, remember, your athletes in general just might not have the same fitness and heat acclimatization that they normally have because things are different. Second, you could have many people who have recovered from COVID. They might not even have ever known it, might have never had a positive test, might have had mild signs and symptoms, but they may have long-lasting pulmonary cardiovascular issues that make them less than what they were before. So if you hold them to the same standard as previously, they might not be able to meet that and might have to work even harder to keep up. And third is you're going to have people who currently have COVID, you know, on the field. I mean, and they're going to have complications associated with that, even though they might not have yet had a positive test. So just keep that in mind, that those 3 different things that you may face that are very unique right now that we have not had previously. So again, Scott, thank you for giving us this opportunity to interact. And Rob's going to be around the whole time to be able to answer questions.
Yeah, thank you, Dr. Casa. One last thing is, stratify these groups of athletes and they're based on their fitness, like Dr. Casa just mentioned, and just communicate and be in tune with your athletes. I know many ATs and coaches are, but we have to be even more so than we have been in the past. And if we really stratify, like I talked about at the beginning, think greatest risk, think like, okay, if we push these kids too hard, we can have a cardiac issue, a heat stroke issue, an exertional sickle cell trait issue on our hands. We need to prioritize those because we anticipate that this could be one of the worst sudden death years ever if people and folks don't do this in a smart way and be aware of what's going on. We want to keep these athletes safe and playing the sport they love. So thank you very much, Scott, and everybody for your time and your attention. I really appreciate it.
No, gentlemen, I appreciate your time and what great information. We will make these documents, the infographics, the links to KSI, all available online. We'll send emails out so everybody has access to those. There's been some requests for that. And I just hope that gives everybody an idea that, these individualized training programs, that was a great point earlier about the need to evaluate athletes individually during this time, because I think, and as we're going to move here into some details that everybody would love to have advice on, I think we can't get lost in the details that we forget to see the people behind the drinking fountain, for example, that everybody wants to have an answer to. And, I just think that that's our plea to everyone is to be able to see this from a view that puts the worst of the worst scenario at the front of your mind. And so we're going to move into this question here. Outside of the procedures that are already established by the UIL, what operational changes will you be making as school resumes and sports resume? And this is where we'll get into talking about facility space and treatments and injuries, PPE that's being worn by staff, hydration, big topic here, staffing. There's been a question that come up about, okay, what if I'm in a school district that has a single athletic trainer and they have a COVID exposure? Do school districts have a plan to be without their athletic trainer? There may be, we can address that here. There may be some plans here for that, but I think that is a question that needs to be addressed within your policy making, within your OICOS or group that you're going to be coming up with these plans. But let's start. I'm going to start with Dennis Hart, if you don't mind, Dennis. And I know you've written a document that's going to guide Mesquite ISD, all of your schools, your coaches and athletic trainers. If you can just talk real quick about the importance of this multidisciplinary plan and policy, and then we're going to get into the weeds a little bit with some of the practicing athletic trainers about their policies, protocols, and really procedures as it relates directly to COVID.
Thank you, Scott. Yes, I appreciate the opportunity to share with what we are doing and what our plans are in the Mesquite ISD. But I especially want to thank our athletic director, Cody Groves, who is leading our district athletic office in a very positive and professional way, and certainly respects the input from athletic trainers, and especially he has worked very closely with Bucky Taylor and myself in establishing these policies and protocols and best practices. It was very interesting in the last week of May, our superintendent, Dr. David Brunlin in Mesquite ISD, asked to meet with Cody Groves, the athletic director, Bucky Taylor, and myself, and he laid out his philosophy and vision for the Mesquite ISD. And so his charge to our team was to develop not only best practices and what we thought was the best way to approach the return to sport, but also to educate our community, because we feel very strongly that the community needs to have confidence that we have the athletes, parents, teachers, and coaches' best interest in our returning to sport. And so that was a very positive experience, and I would encourage those of you on the Zoom here that you look at the Mesquite ISD Facebook page, and we made 2 different videos, and one is athlete-led about you know, are you willing to do your part to return to your sport, and the other is for parents, and so I think that did a very nice job in preparing parents for what's coming as far as related to return to sport. And so then we did work through with Cody Groves and the athletic trainers in the Mesquite ISD to develop a general plan and a specific plan. And of course, we're still tweaking that as we move closer to the start of school. But we all know that as we go back to face-to-face school, in-person school, that there will be challenges there. And I, like Mel, have concerns for our coaches, and certainly we need to consider them, but they need to understand that we're going to follow these policies and procedures. We're going to follow best practices, and it's for the best for not only the athletes and their families, but also it's best for our community, and it's best for them. And so we feel very confident that we're going to have a positive response, and because we need to not be pushing the boulder uphill. The boulder needs to be running downhill, and so we have established that idea, and so we feel good about that. But you know, one of my major responsibilities, other than policy and working within the athletic staff, is middle school. And so that, in my mind, is the elephant in the room. And we are still in discussions and in developing what we're going to do at the middle school level. And basically, when we go back to face-to-face school, when and if, certainly all are up in the air about that, but our plan is either September 8th or September 14th, and how we will start the middle school kids, and that is a completely different discussion. And so I think that all these areas are important, but what the main message I want to give you right now is that there are 3 good plans on the TSATA.com website. That's Texas State Athletic Trainers Association.com. Jamie and Josh Woodall's document is there, and the Mesquite ISD document is there, and also the Houston Methodist document is there. And so I would encourage all of the participants here today to go to that TSATA.com website, look under the yellow banner on the front page, and you can download those documents. And if you don't have something that you feel really strongly about, then look at that, and then I would hope that you could find something you can apply to your particular school district that would assist you in preparing for the return to sport. So I think now I'm going to give it back to Scott, and he can bring on our other distinguished panel.
Okay, great. Thanks, Dennis. We're going to start with Terry first, and then EJ. And I'd like you guys to just talk about your facility spaces, whether it's your athletic training rooms, maybe it's your weight room facilities, your daily schedule, just some of the changes that you're making in your school districts as it relates to COVID. Like, for example, I know we have relocated our weight room space and are therefore relocating our athletic training space. And so I'd love to hear from you guys. Let's start with you, Terry, and then EJ, you can just take it from there.
First of all, I want to say that the policies that any of us on this panel are going to talk about today is not necessarily what's going to be best for you. We're just trying to give some help and examples of things that we're doing that hopefully can help guide your plan, but know that we are not the end all be all, and we're just trying to be helpful and let you know kind of what we're doing. So in our facility spaces on our campus, we are, as a district, we're not going to dress out our PE classes. And so in our PE locker rooms are within our community athletic locker rooms. And so that way we'll be able to utilize those PE lockers for our athletes. We have a shortage of lockers, just like I'm sure many of you, all the other ones do. And so we were, in the past, I've had kids doubling up, and we're not going to double up lockers. And then if we still have locker issues, then we might just have the kids take their bags in the gym with them. Because we have theft problems just like everybody else also. So, trying to spread them out in the locker rooms. In our football locker rooms, we've intermingled our offensive and defensive lockers. And so we can send the offense in there first to spread out in the locker room, get them out of there, and then we can move our defense in. And so we think that'll help us with spacing in the locker room. But we are going to require them to wear their face mask in the locker room and in the buildings. We're on the Champion campus, every kid's going to get one of the neck gaiters, and that's going to be their face protection for athletics, and it's going to be part of their uniform. That's part of the process as well. As far as the training room on both campuses, our estimates is that we can have 4 athletes in the training room at a time for treatments or taping or whatever. So we're going to have appointment time set up. We're going to set up a Google Calendar where there'll be a link on our website, and the kids can go in, sign themselves up for a time, 15-minute time slots, and no longer, simply because the policy states that as long as you're not around somebody for more than 15 minutes, it's not considered close contact, especially if you have a mask on. We're doing 15 minutes treatment times, and we're going to have to spread it out anyway so that we can accommodate more kids. So that's one thing we're going to try out. And again, we know some of these things may not work as we think we are planning them to work, but those are our initial thoughts. And Champion's a 5A school, and so we don't start till later, but our 4A Boerne High School is going to be starting on Monday. And so they're going to be guinea pigs in our district to see how these things work. Hopefully they work well and we move on smoothly. But those are some of the things. In the weight room, we're just staggering. In the past, we've had maybe the volleyball and basketball teams being there at the same time. We'll stagger the teams. In the girls' locker rooms, we're going to have one team at a time in the girls' locker room. So volleyball will get the first slot since they're in season, and then basketball and soccer will be able to go in the same time because they're on opposite ends of the locker room. Just some of those things are just to keep spacing in mind, to try to do the best job we can to keep them separated and keep everybody safe.
EJ.
Yeah, we've decided that we're going to change it and not call it treatment times this year. We're going to call it evaluation times, because we're only going to block kids off for 10-minute increments, and that's just enough time to do an evaluation. We've also decided we're going to do a lot of home programming this year. So we're putting it on the kids, and we're putting it on the coaches and the parents to make sure the kids are doing their rehab at home so they're able to play to the best of their ability. We've also broken it down for recovery days, where we will put all of our foam rollers in our weight room for football and in our indoor facility for kids at our high school. And You will use our massage guns there, use our foam rollers there. Will not be in the training room for any recovery type issues. We will not use our whirlpools this year, and our coaches are aware, and they're on board. They understand like these are the things that we have to limit. And I just want to say this. We've tried to put all these plans together, and we're trying to do everything we can to be safe. We have to understand as athletic trainers that we only have these kids for a few hours a day. We have no idea what they're doing when they're not with us. And I think that's important for us to realize also is we have to preach to them, you have to be safe at home too, not just at school, not just in athletics. So I think we take on a lot of burden thinking that we have to do everything and be responsible for everybody. But we also have to understand these kids have to be responsible for themselves also, and the parents have to be responsible also.
Awesome. EJ, we're going to transition here into taping and treatments. Do you have anything to add to that, or is that kind of covered as part of what you just discussed?
Well, I talked to my football coach actually yesterday, and we talked about instead of having offense coming to get taped and then defense coming to get taped, that we're going to come in positions, and we're going to stagger that and make sure that my students that will be helping us, obviously taped and gloved, but they're going to do wrist taping outside, and because that just limits the number of people we have in our training room. We have a 3-seater taping deck. We're only going to use 2. We have additional portable taping decks. We'll space those out in the training room. So, and we may even try to get ankle braces for our O-line and D-line just to limit, the number of kids in the athletic training room, and those can be washed, and we don't have to worry about doing anything with those kids.
Right. Chris, can you talk about, just from your perspective with this patient care portion, the treatments and those things, how that's affected you in Pearland?
Yeah, I'll talk about that real quick. I want to go back on I just wanted to touch on the facility part real quick and let everybody know what we're going to use this year. It's a free website time where you can athletes can schedule. We're going to give them will be QR codes posted everywhere, and if they need to schedule time with us, they will QR code. It goes straight to the pick time, and then they just fill out their information, and then we get the calendar for that. But I think everybody has to figure out, what number of athletes you want to allow in your athletic training room. I have over 2,500 square feet. I'm estimating. So we have fairly large athletic training room. We're going to limit to 8, really 10. We're going to allow 2 spaces for acute injuries to come in at that time. They're only going to schedule 8 people on the pick time, then they come in. But determining what treatments are safe or not safe, that's something each school or school district needs to do. We've determined we're not going to use, like EJ, we're not going to use whirlpools either. We'll fill the cold whirlpool up. It'll be there for emergency use only, especially with these athletes that are unacclimatized, or they're not in shape because they've been sitting at home, or they've been sporadic coming to camp. So we got to make sure for emergencies, we have those cold whirlpools. Flexi wrap, we decided we're not going to use flexi wrap. If you're wrapping an ice bag on a kid's shoulder, you're basically hugging that kid and you're right in their face. So we've taken all the flexi wrap out of the athletic training room, even though yesterday I just received about 8 cases of flexi wrap. That'll be for next year, I'm assuming.
Those are some great pearls there, Chris. Thank you. Let's talk about just personal protective equipment, not only for staff but for students. I know there's a lot of questions about athletic training.
What you say?
Oh, I think I may have lost you. I just said I appreciate your pearls of wisdom there. We're gonna talk about PPE, protective equipment for staff and students, and I'm gonna ask Terry and Mel to address this. But I think that's a big question right now that people have. It's not just about staff, but about their students, and how close are we willing to allow athletic training students at the high school level to be to these athletes, protected or unprotected at this point. So let's start with you, Terry.
So that, that's my biggest thought process through all this is what's going to happen with the students. I have almost 50 student athletic trainers. And so a big focus in my mind is to keep them safe and protected. So visiting with our physicians and other people in the community, I think standard PPE for us practicing is without a doubt mask and eye protection, and then gloves and then having gowns available. I don't know that I'm necessarily going to gown up every day and go out on the field, but I think all of my kids are going to have masks. I've already ordered them for them. We're all going to have eye protection. If we can't get eye protection, and my plan for eye protection is I went to Home Depot yesterday and bought safety glasses at Home Depot because they need to be, and that's what emergency physicians are doing in San Antonio is they're running out in hospitals. So they're going to Home Depot and buying safety glasses to use for PPE. And so, of course, we've always had gloves available, but it will be strict enforcement with the students with gloves, and then having the gowns available for those bigger issues that I'll deal with on a personal level. But the students in my mind are the most important things in our training room areas as far as keeping them safe, because they're going to be frontline healthcare workers just like we are. And so I'm going to talk to them about the situations where they need to take a step back and let me jump in and be the front line more than they are, because I want to make sure that they're protected and that their parents are comfortable sending them to practices and games and being able to be there and enjoy the experience.
All right, Mel.
I had a long discussion about this with our team physician last week and our 4 athletic trainers. I think that my biggest concern administratively is to explain to parents what is the student trainer's role going to be and how are we going to protect them. And so we're working on that policy, kind of like Terry. There's going to be a limit to what they interact with. I think it's going to be kind of hard to explain to a parent if you've got a student trainer, the only one filling up bottles and coming into contact with those players. That's going to be a difficult thing to explain. So it's going to be a lot of planning. As far as PPE for our athletic training room, our athletic trainers, we've ordered face shields for them and the student trainers, along with masks, gloves. We've ordered the Clorox 360 sanitizing systems that'll be used in the athletic training rooms and in the weight rooms and locker rooms. We've had a lot of support from our safety operations department in helping us procure these items. So it wasn't a big budget hit for us, but they've been super helpful in understanding we need these. The other thing we're doing is we ordered gaiters for all of our athletes. They'll be issued just like their equipment. And we ordered masks. And so working with our custodians on a rotating cleaning policy for the training room and the weight room and locker rooms is crucial right now. And so we've established that plan as well.
Awesome, thank you. Let's talk about hydration, which is, I think there might be 200 questions in the chat about hydration. So let's start with Terry, if you don't mind, and talk about how you guys plan on handling hydration.
So in our district, we've decided that all the kids are going to bring their own water container, receptacle, whatever you want to call it. So they do it at strength conditioning. For the most part, our volleyball, soccer, basketball teams have already done it in the past. They always bring their Hydro Flask or whatever it is. So, football will be an adjustment, but they're all going to bring their own. The Greyhounds, when they start on Monday, everybody's going to bring their own bottle. Part of their plan is that they're going to get the booster club to purchase several cases of water. And at the beginning of practice, the coaches are going to ice down the water bottles. And at the beginning, each kid's going to get a bottle of water, a 16-ounce bottle of water, and they're going to drink it. And then they're going to have their own personal container for practice. And then sometime during the middle of practice, they're going to get another bottle of water. And then they'll continue on. If they run out in their personal container, we're going to have the cowls on the sides that will be filled up with whoever it's going to be, with gloves and masks and goggles, and disinfecting the spigot every time it's used. And so that's kind of the plan they have. As far as at Champion, our plan is going to be, yes, they bring their own stuff. If a kid comes to school without a water bottle or shows up to practice without a water bottle, we're going to have water bottles available, disposable, but we're going to write their name and the date on the bottle. And so that we hope that someone won't go grab Johnny's bottle and their name's David and use his water bottle. So we're going to have his name in Sharpie, the date that they were issued that water bottle so they don't reuse it every day. So hopefully that, I don't say that's a perfect plan, but that's a thing we're going to try. I have a son that plays football, and for him, he's going to have a water bottle for the school day. He's going to have a water bottle for the period practice, and he's going to have a water bottle for after school. And so have them bring multiple bottles, keep them in their car, whatever. I mean, if they can, if that opportunity is there, keep them in their locker, whatever. But just because our water fountains, and I'm sure everybody's water fountains are going to be disabled on their campuses. So having water available, our girls coaches are planning on getting cases of water donated by the parents to keep in their offices. So if a kid runs out of one of the girls basketball players runs out of a water bottle at school or needs it for practice, the coach will hand them a water bottle out of their office and they can fill their container with that. Just things we're bouncing off of each other as a staff to try to see the best way to keep them hydrated.
Yeah, those are great. Those are really great suggestions. What about you, Chris, in Pearland?
We've decided to, can y'all hear me? All right. We've decided to do no shared bottles, the squeeze bottles, the Gatorade bottles. Instead, we want, just like Terry, we want the athletes to bring their own water jug. And what we're suggesting is we want them, especially football, to bring the 1 gallon, like the 1 gallon igloo jug. It has a wide mouth that you unscrew to fill up. And what we'll do is we'll read that during practice. I know people are converting to water fillers. I'm going to share my screen real quick. To this type of water filler where you have, you can buy this device on Amazon, $50, it's a foot pedal, and you connect it to your cow and you can refill, their water jug at practice. So here's what it looks like from Amazon. Luckloy, $45, but it's a foot pedal you can connect, and kids can refill their bottle. Also what we've decided to do is we're debating whether the athletes keep their jug in their locker overnight or not, because we don't want them coming to practice without it, but we want them to clean those jugs also. Because what we want to do is they bring their jug outside the locker room, and we have an ice chest right there. We'll put a scoop of ice in it for them, and we have somebody filling their water jug as they leave. Or we're working on a PVC pipe on the water and it falls out, and you can fill your jug up. That's an extra 20 seconds for you to get out to practice. And then so at practice, our mule or our gator will have our cows there with ice chests. When an athlete's at practice and they're out of water, all they do is unscrew their lid and set it next to the jug, and then we'll drive around us that, hey, they need to be filled up. And so my car will drive by, we'll put scoop ice in it, and fill it back up with water for them. One thing we do use typically is sponge buckets, ice sponge buckets. We won't be able to use that this year, shared sponges. So we're going to use towels. I'll have those on my water car also. Designated cooler that will have the ice towels in it. It's a single-use ice towel. We'll use a kid that we see that may need it, and then those will be laundered for us. And one thing we got to talk to we continue to talk to our coaches about is that athletes cannot be denied water. This is different than any other time where we're in the huddle with them, giving the athletes water. That's happened this year for us. So we encouraging the coaches to give frequent breaks, more frequent breaks, and to allow undenied access to water. If an athlete wants water, they can have it at any time. Single-use cups, we'll use those. I mean, we're not going to use those at practice, but that's something you can think about if you want to put that in your policy. And then again, we have our cold whirlpool for emergencies. Any other outdoor practice, if you're talking about track or soccer, they'll bring their bottle or their jug that they have, and then we'll have those converted cows out there for them to refill that. And then we'll just make sure we're refilling those cows, those touchless cows. Indoor practices, same thing. Let me see if I have a picture of this. Yeah. Let me show you real quick. And so for indoor practices, these are Gatorade. We put touchless devices on the Gatorade coolers. This one actually works for the Gatorade cooler, but I had to get a washer. There's another one that works a little bit better. And then I've ordered one, I haven't come in yet. That's for, we also have Igloo coolers, which has a bigger hole. So I want to see ordered if they're going to fit the Igloo coolers. So that'll be indoor sports. They'll have their own hydro flask or whatever that they can fill up at those coolers at any time. And I think you need to make procedures that may be different for varsity or JV or middle school even games. For football game at the high school, for varsity games, we're going to use cups only. We do have a procedure that we've put into place, or that we're going to put into place, where we will have an ice chest on the sideline with 2 racks of bottles in the ice chest on either end of the field. When there's a timeout, we'll bring those 2 racks of bottles out to the field, and each athlete will get their own water bottle. Then after the timeout, let's see, after the timeout, I'm going to share my screen one more time. I think, am I sharing? Okay. We're going to use this fish cleaning table. We're going to wash the lids of the water bottles. We'll put a 5-gallon bucket underneath for the drain, and we'll just hook a water hose up to this faucet. And so we'll clean the water bottles, the water bottle lids on the sidelines. We'll be able to wash our hands on the sidelines. And we'll bring that to varsity games. We'll have that at home for freshmen and JV games as well. For our JV games, we may have our JV away games. We're going to have to figure out something. I think we're going to bring soap and water, some type of dishpan type of thing to clean those bottles, and have the same procedures for away JV or freshman games. For our junior highs, we do have athletic trainers at our junior high, but it's slightly different. We have 2 athletic trainers for 4 junior highs, so they're on campus half the time. What we're thinking about doing is having a table or maybe like a entry mat where kids that are on the field, that's where they put their water bottle, on that table. And when there's a timeout, they can come to that table. They know exactly where their water bottle is. They're not searching around all over the sideline. So, one other thing I thought about is for especially middle school or games that it may take longer to get water for timeout, is talking to those officials and see if they'll out a little bit longer so that everybody can get a drink. But those are things that we've talked about doing, things that we're planning on doing. I know it's going to be different. Things will probably change between now and then the first game or second game of the season.
Wow,
Scott was going to talk a little bit about what we're doing for games, because I didn't talk about that.
Okay.
Or to Chris, no, I didn't think of the fish cleaning table. That's a good idea. So we're going to use cups, and we're going to use cup rack during timeouts. So we'll carry 2 cup racks out. And Jamie was talking about this other night on another Zoom we were on, but the concern was what does the kid do with the cup when he uses it? He can't stick it back in the rack. And so I'm thinking have a 5-gallon bucket with a trash bag in it that another student has to collect the cups and bring them back to the side. But we'll definitely use cups on Thursdays and Friday nights, all game nights for football.
Thank you, Terry. Look, I know there's a lot of this is overwhelming to a lot of people. I'm seeing some comments on the chat specifically about, you know, well, what if we don't have athletic trainers, or what if we're understaffed, or this is really the big challenge with return to sport. And I think this is why it's important that these conversations are had at the highest level with athletic directors who are on the call, with upper administration. You know, if there's potential, you know, for you not to be able to provide those types of services, I think it's a hard question to ask. Are we prepared to have sports, you know, the way that they're intended to be? And so everybody is going to have an issue with that. And I appreciate Chris and Terry and just the innovation. Everybody says athletic trainers are jacks of all trades, and obviously you guys are. Let's talk for just a second about cleaning facilities, equipment. I'm going to start with Jamie. I know she's our resident expert right now in that topic. If you could, Jamie.
Yeah, so when it comes to cleaning and disinfecting and sanitizing and trying to figure out what the expectation is from our regulatory organizations, I think it's important that we understand what the definitions are about those things, because in a lot of the frameworks that have been provided to us with parameters, sometimes it says clean, sometimes it says disinfect, and sometimes it says sanitize. And honestly, do they even know what that means when they're writing that? And do you know what that means when you're trying to implement that? And so if it says clean, then that just means simply a spray and wipe, removing visible and maybe non-visible debris from the surface of that, from the surface. And so that's not necessarily going to eliminate the germs, and but it does reduce the number of some of the contaminated matter, but it's not an extensive process and is not going to be sufficient for this. And then whenever you talk about disinfection and sanitization, one of the things here is a lot of people think that sanitizing is more of a process than disinfecting, where disinfecting is actually a more elaborate situation than sanitization. And so with sanitization, you have a reduction of bacteria using a product set by public health standards. And you can find lists of those on the bottle. You'll turn it around and it'll say to clean, and it gives you directions, and it'll say to sanitize, it'll give you instructions, and then it says to disinfect, and then it will give you instructions. And so understanding what product you have and how to use it and what you're actually doing with it. So if you're going to write in your plan that you are going to disinfect every single day, you better know what that means, because most people don't understand what that process actually looks like. It's not a spray, wipe, done, disinfected now. That's not the case. So just make sure you understand those definitions. They're on the CDC website and it's linked to COVID as well, but these definitions didn't change because of COVID. They've been this way. We've just probably never focused on that very much. You also have levels of disinfection. You have low level, high level, and hospital grade disinfection. And so what we need to be using for COVID is a log 5 or a log 6 product. There's a lot of products out there, but what I would caution you on when you're purchasing these items is, what are you going to actually be using it for? Because if you're using it on mouthpieces, water bottles, coolers, cows, whatever you're going to use, and this is not new because of COVID, but is being brought to light because of COVID, you need to make sure that product is food safe. And if you're using it in your locker room, in your weight room, you're gonna wanna make sure it's non-corrosive. Because I know in Burnham, we just bought some new weight equipment, and if I go in and spray something on those weight bars that causes them to rust, Coach Rory Faber is going to have my hide on that, right? So we don't wanna cause more of an issue with these things. And so understand what product you're using and what you plan on using it for. And so if it is a log 5 or log 6 product that is food safe and non-corrosive, you can use it on everything. But if you've decided on a product that is corrosive, is bleach based or what have you, you can't use that on all of your products. Now, it might be sufficient to kill COVID or to mitigate the risk of spreading COVID, but it may not be appropriate for what you're spraying it on. So that's really important there. And then as far as the delivery of those chemicals, how you're going to put those out there. So I heard a lot of talk at the beginning of this, people buying foggers and sprayers and kind of using those terms interchangeably. You can't use those interchangeably because they all do something a little bit different. A fogger is just literally a really elaborate spray bottle. Okay, so yes, it does make it more convenient, but you're not necessarily changing the product and how effective it really is. It's just a really exciting way to get the product out there. So as far as electrostatic sprayers, that's one of the recommendations out there, and Burnham does use electrostatic sprayers with our food safe, non-corrosive product. And the reason why electrostatic sprayers are so important is that they put a charge on the product, the chemical product that you were spraying. And so whenever it lands on the item that you're wanting to disinfect, what you're actually doing is putting that positively charged particle, and it aggressively adheres to your product. So it doesn't just land on it, it encapsulates almost. So it's much more effective than just spraying it. The other thing on your products, and this is something you'd want to talk to a rep about if you're looking at a lot of different products, but you want to make sure you have a product that you can just spray and leave on versus having to wipe it. The product that we're using does not leave a film. It's safe on technology because of the fine mist that is used with it. It can, as long as you're not just dousing a computer with it, it's safe for those products. It can get on paper. It's not going to make your paper kind of wrinkly with wet, unless, again, you're just dousing it. But if you're going with the fine layer of these things, especially on high touch point areas like doorknobs and door frames and different things like that, then that's something that I would recommend getting. But understanding what products you have and then how you're saying you're using them is really important, because you know, athletics is going to be in the public eye, and if you say you're doing one thing but you're actually doing something else, someone may call you to the carpet on that, and you don't necessarily want that headache on that. And then just a few tips, practical tips. I think leaving any doors open instead of having to open them with the door handle or push the bar, if it can remain open safely without causing a liability of some sort, have door stoppers or a way to leave those open so that those high touch point areas are less touched. So that's a little bit of what I have, and I think EJ was gonna tag team on that.
Actually, I think what we're going to do real quick, sorry, EJ, if you were about to speak, I didn't mean to cut you off, sir. We've got about 15 minutes left of our allotted time. And so, there's been a lot of questions, a lot of great information. One of the questions that continues to come up is about the what ifs of what if we don't have somebody? What if we don't have the time? What if I'm an athletic trainer who's teaching in the classroom? I would like Dennis Hart, if you don't mind, because I was going to have you address middle schools anyway, which is one of the areas that we know that school districts are going to struggle with. And I just thought maybe you could address potentially those hard conversations about the what ifs just briefly. And then I would like to ask a follow-up question to Dr. Huggins as well about testing.
Well, Scott, those discussions are difficult sometimes, but if you do not ask, you will not receive. I heard someone say that once that's on this panel, and you seem smiling at the moment. And so the good news in Mesquite ISD is that we were 2 weeks away from hiring 5 athletic trainers to be added, 1 to each of the high school staff. We already have 2 at each, and there were going to be middle school responsibilities that go with that 3rd athletic trainer. So I think staffing is certainly a major consideration as we discuss how we're going to deliver healthcare in the COVID era. So my superintendent assured us that to keep this on our burner, and that hopefully when the next year's budget is appropriated, that we will be able to do that. So I think it's important that you have the conversation about what is the vision for sharing this. In my experience in Mesquite ISD is that I work very closely with the school nurses and the coaches, and I have to depend on my school nurses to kind of be the eyes and ears on each of those 10 campuses. And so I'm very blessed in that way, and with our athletic director, Cody Groves, and certainly each of those middle school nurses, they are my best friends during the school year, and certainly they do a great job. And I think we have developed a collaboration that's a great learning experience for both of us, and certainly they are advocating also for the hiring of that athletic trainer that will have middle school responsibilities. So is there something else that you want me to address?
No, I think that's great. I just think it's important that, you know, if you do feel uneasy or have a question, that when you have those conversations, I think, you know, you can't, as the athletic trainer, you can't be expected to be all things to all people at this moment in time, you know, and some of the things that we're talking about to mitigate risk can be the responsibility of coaches, and they are the responsibility of student athletes on their own, you know. And I think it's about having those conversations ahead of time about what the expectation is, and helping coaches and administrators and even parents and students see the big picture, that if we can't get from this drill to this drill in 30 seconds like we normally do, the world's not going to come to an end. It may be a 24-period practice that needs to become an 18-period practice. There was a question in the chat about, has the UIL considered extending timeouts to allow for a longer break period? I don't know the answer. I think it's a great question, and maybe Coach Dowling or Bob could ask UIL about that. I think that's a great consideration about that as well. I did want to ask Dr. Huggins, there's been some question about testing. I know we have some school districts who are doing some local testing, and the question about, should we test our athletes, and since they're not in a bubble, and there's been questions. I talked to a gentleman at the University of Michigan who's had athletes test positive upwards now of 60 days. And could you just speak to testing from what you know at this point?
So you're speaking testing of COVID, correct? Not fitness testing? Yeah. So I think, you know, the recommendation that we have in our state is that, and I kind of shared that in that algorithm, is that you get tested if you are in close proximity or have any suspicion that you may have, been potentially exposed to COVID. Having that test, and the type of test now, as many of you are probably following the news and the reports out there, is that, some of these rapid turnaround tests have shown some less than accurate results at times with some false positives or false negatives and false positive rates as well. So things just to, definitely consider. But I think having the test and having a protocol, if a testing site is available to do so, you should. Each school and district is going to have to talk about the mechanism for, not just athletes, but for teachers and staff and, people who enter that building, if they are allowed to enter the building. These are decisions that, I don't envy anyone to have to make. But once an athlete does test positive on your team, there needs to be a policy that you agree upon, with the oversight of your physician. We've talked in the past about your health or your risk manager at your district. Unfortunately, some school districts don't even know that the athletic trainer is a part of the risk management within a school district. I've personally firsthand experienced that up here in Connecticut one time. But being, an advocate, working with them to try and come up with a solution that's feasible for testing is key. Many places are not the NBA. We are not the NFL. Not, MLB. We can't test every single day. And I think we just have to utilize testing to not overwhelm testing, but also be able to try to make informed, decisions. And, when in doubt, I think the quarantining is what has been recommended. Whether you have, you use symptoms as the guide, and I think it's at least 10 days have passed since symptoms have first appeared, and at least 24 hours have passed since the last fever, cough, shortness of breath symptoms have improved. So I think these are all factors that we have to, weigh as we allow our athletes back to play. And I think when you have testing, there's still the symptoms that you have to consider. So even if someone does test positive, you still are wary of the symptoms that they have, although they may not be as likely to infect others after the period of the 14 days. There might be some underlying conditions, right, that this person themselves, inflammation that has not subsided, and the immune system is an expensive energy system. You think about an athlete who has fever and is sick and has to exercise in the heat. You're asking that system to work double time because when I say expensive, I mean from an energy standpoint, which is why we tell you to eat plenty of drink plenty of fluids and eat lots of simple carbs when you're sick, so that you can try to help fuel that system, so to speak. So I wish I had more answers. I really just, you need to follow your best judgment and utilize what the CDC and your local and state leaders are suggesting in terms of testing, and then use that information in concert with your local leaders and when I say local, I mean athletic directors, school superintendents, principals, team physician, or overseeing physician to make those decisions.
Awesome.
Yeah.
No, I appreciate that. It's a great answer. And we're close on time here, and I recognize that we've probably created more questions at this point than maybe we've had answers to. And I think that the association is committed to continuing this conversation. Potentially, there's other conversations about value and staffing and best practices that we're gonna eventually cover. But I appreciate everybody on this panel, your expertise, your professionalism, your attention to detail. We will make our contact information available to anybody that wants it to have more conversations in depth, to be a resource. But I just want to thank the association at this time. I'll turn it back over to Bob.
Thank you, Scott. This has been a tremendous webinar. I want to thank Scott and all the esteemed panelists that joined us today and contributed to today's roundtable. I think the discussion that we heard today will no doubt lead to probably improved decision-making among athletic trainers and coaches and athletic directors as we return to practice and play. If I'm today's coach and athletic trainer, I see today's discussion to serve as a kind of a template for a safe return. We didn't answer every question today, and there's a lot more, like Scott said, that probably are coming up as we speak. But I think it was a good start today, and your planning and professionalism really contributed to the success of this webinar. We will edit this video over the course of the weekend and get it posted on the THSADA website. I'll also provide it to Scott. He can share with athletic trainers around the state. And if desired, we can do an additional webinar on similar topics in the future. We have several great webinars that are already posted on our website. So if you want to know more about THSADA or the things that our region directors are working on, or our athletic trainers, just check us out on the website. Thank you so much, all of you, for sharing with us today and joining us. We had nearly 1,000 people that listened in on either YouTube or the Zoom channel. So great job by everyone. Thank you so much. Panel, please stay on for a few closing comments.